Good afternoon. This is the second in the series of the Health Foundation's webinars for Scaling Up Improvement Program, and the topic today is Leading Large-Scale Improvement. My name is John Deffenbaugh. Some of you may have met me as part of the facilitation of events like the induction program, and I'm joined by two colleagues today. On my right is Dr. Nadeem Moghal, and on my left is Darren Cooper. Nadeem is Medical Director at Barking, Havering and Redbridge University Hospitals and has a wealth of experience and background in leading change, practical leadership and improvement science. Darren is a professional program and project manager. He's currently program managing the Health Foundation's SAFE program. He has considerable experience of working across organizations and facilitating multi-professional delivery. So between us, we'll be discussing the topic for today, which is very much around leading large-scale improvement. We'll be bringing in our personal experiences, bringing in some war stories and insights we have, and of being involved in all of us leading change, concentrating on particular on the added value that the leadership role, hearing both from Nadeem and Darren, can bring. And then focusing on the right areas of leadership, how to go about it, tips of leadership, and what works, and maybe what to avoid doing. We've sent you some background reading the 4 articles in advance, so hopefully you've had a chance to read those. And having read those, then, as I say, you can watch the movie. Now, crucial thing is we're looking for your questions, so please make sure you follow what we're doing and come up with questions that prompt us to develop our thought process and meet your expectations for what you're looking for out of the webinar. If you're viewing on full screen, then reduce that, and then you'll see the question box, which is just below the video screen, and then send a question there. And I'll keep prompting you to please send your questions as we go through today. And if I forget, then Darren and Nadeem will remind me also. So what we want to do first off is just take you through some background, some bit of theory relating to the practice. And that relates to the 4 articles that we sent, and hopefully you've had a chance to read those, and if not, and I'll just be summing up as we go through. The first one is the article by John Cotter, and the headline that John Cotter talks about from Harvard Business School is when he's referring to leaders, he says, leaders don't just make plans, don't just solve problems, they don't even organize people. What leaders do is prepare organizations for change and then have them cope, help people cope as they struggle through that change. And you'll see from the slide here that he makes this contrast between leaders and managers, and people write PhDs around this, so recognize that there is a degree of overlap. But again, from Darren's perspective coming in terms of managing and budgeting, Nadeem as a leader, setting that direction. And then again, instance there of organizing and staffing versus aligning people. And the leadership role of aligning people is not just down the organization, but very much across organizations and systems, because a lot of the large-scale improvement is across the systems. And then the viewpoint of controlling and problem solving versus the motivating and inspiring. And again, it's not to contrast, but it's a bit of obviously the head and the heart, management about the head, leaders about the heart. But again, let's not think of it as an absolute contrast. There is an overlap, and maybe that's one of the things we can explore, the difference between leadership and management. The second article we sent you was one from, again, Harvard Business Review of Harold Sirkin. And that was around the DICE model, the DICE change model. And the way that article is headed up at the outset is the observation that companies or organizations, in your case, and scaling up improvement projects, must pay particular attention to the hard side of change management as they do to the soft aspects. By rigorously focusing on 4 critical elements, they can stack the odds in favor of success. And the authors then highlight those 4 elements, as you can see on the screen, in the sense of the duration of the project, how long it's taking place, what the reviews are during the course of the project, and making sure you critically keep coming back to that review and keep promoting the focus on the change and not just running into the ground. The second element through that is the project team's integrity. This is very much around having the balanced team, and again, it's a balanced team that would have both leadership and project management. You know, again, we'll hear you can't have one without the other. The third element then is also around the commitment to change, and that's commitment both of top management but also employees. And this again links back to John Cotter's leadership story, which we showed in the first article around leaders leading and having the narrative to tell that story so that people want to follow them. And the third hard element there is the effort that people put in. And you'll be well aware that you're doing these projects in some cases in addition to the day job. So what are the trade-offs that you have to do to make this work? So that's the second of the four articles and the second of the four models we wanted to highlight. And the third one here is the article by Richard Steele about culture and complexity. And again, Richard begins his article by saying that conventional approaches to organization culture and change have been inadequate, partly because these have been based on outdated models of organizational dynamics. Complexity approach can offer a new perspective which leads to a radically different kind of practice for change agents. So you, in many respects, are change agents. And what Richard is showing in the model here in the top left box A, that you're a diverse set of change agents working in an isolated way in some respects. But to make it work, to bring about change, what you have to do is connect. That connection is very much around the basis of the conversations, the communication you'll have, and recognizing that leadership is not about machines, but it's around system leadership. It's around the leadership paradigm around systems. And then thirdly, the emergent pattern that you're beginning to see, and that feeds down into the system of the leaders being able to facilitate the conversations that underpin this change and adopting this system approach to leadership. So that's very much what Richard Steele is about. And it says in the headline there, leaders facilitate emergence, and culture very much is something that emergence, if we had magic wands, it would probably be so much easier for you all, but sadly we don't. And the final article is based around Ron Heifetz and colleagues writing around leadership in a permanent crisis. And Nadeem, you've had the pleasure of listening to Ron, and you can probably pass on some of those stories. What he makes the observation that when the economy recovers, well, it's a long time, the tide's out, it's probably not coming back, resources are limited. And what Ron Heifetz is saying here is that leadership is accepting responsibility to create conditions that enable others to achieve shared purpose in the face of uncertainty. And building on that, he makes the observation that people resist change is really not true from his perspective. People are not stupid. They love change when they know it is a good thing. What people resist is not change per se, but loss. So again, recognizing that as you're leading these projects, leading large-scale improvement, that the circle here is you have a certain level of formal and informal authority. And then once you get beyond that, then you're going to have to take the risks. That's when you're going to have to recognize what Ron Heifetz calls adaptive approach to leadership. Again, it's as we're seeing through all these other aspects that adaptive leadership, as he comments in his article, and I'll just finish on this, that instead of hunkering down, leaders that practice adaptive leadership seize the opportunity of moments like the current ones to hit the organization's reset button. They use the turbulence of the present to build on and bring closure to the past. In the process, they change key rules of the game, reshape parts of the organization, and redefine the work people do. So the question very much then is around this headline of the topic for today is, how do you actually go about leading change for large-scale improvement? So let me ask Darren first off, with your project management hat on and your experience of many different aspects of projects, what does a leader bring to the party?
For me, excuse me, a leader is the person that really drives it forward. In my experience, is always the ideas person, and they're the ones that have that energy and that motivation to take an idea that they've got for improvement and actually drive it forward. And I think that contrasts very much with project and program management in the idea that really facilitates that But you have, somebody that can take an idea and want to say, this is what we're going to do. Usually, as we've talked about, it's alongside a day job. And they need to be able to take it forward, and individually they don't usually have the resource to do that, be that time or person. And a project manager really facilitates taking that idea and actually implementing it. One of the issues that I've had in the past has been where you have a leader who is very much an ideas person but struggles to focus, and so they have one idea and they start it off in motion, and then they have another idea and they want to move on with that, and really a project manager does two things in that fold. One is that they can just work on a single idea and just kind of tap in with that leader when they need to, so the idea is still progressing without necessarily having to fall by the wayside because the ideas person has moved on to something else. But also where you have somebody that can be easily distracted by lots of different ideas, really can help to focus them and make sure that we deliver on the projects that we're meant to be delivering on.
Right.
So a few experiences where you get this, a term in project management, this idea of scope creep. You come in with this one idea and this is what we want to do, and very quickly that can spread into all manner of things that it never intended to be, and really a project manager should really be focusing that in.
Okay, good. Well, just before I turn to Nadeem and get his view on that, then just remember about the questions, so make sure you go off full screen if you are on it, and then click on that question box, and please get your questions coming in. So Nadeem, you heard from Darren's viewpoint of project manager role, and I'm kind of picking up that part of his job is to make you successful, is I guess what I was picking up there. What's your view on kind of good management capability and capacity that allows you to get on and do your job, and then what do you actually see as your leadership job then?
So I think Darren is absolutely right, but I also see leadership in terms of its multifaceted elements around the individuals that come around an innovative idea that is the start of leading change. So I think that you can have that great idea, but the skill of leadership is how do you lead change with that idea? And of course, you need strong foundation around project management, so timelines. So the DICE construct is really helpful because it talks about, in essence, in some elements, around the discipline of time, the discipline of delivery. It talks about the discipline of being really clear about the purpose of what you're trying to do. But I think as a leader, it's about the clarity of that purpose, but actually developing people fundamentally in not only understanding the purpose, but also in enabling them to be able to do the work that needs to be done. So as a leader, I purposefully say, I am not necessarily the ideas man, actually. I sometimes joke and say every grey hair in my head is an idea I've refused to come out, because actually the ideas are with the people that I work with that I then need to enable and empower to be able to then take that work forward, because it's for them to do it. And the project management component is to provide the discipline framework around that. Otherwise it doesn't work. So you've seen plenty of projects where great ideas fail, and they fail for lots of reasons. Some of it will be because there hasn't been enough of the, it's not the right word, but the bureaucracy of project management is necessary to give you the discipline. And actually the time frame is really interesting. So here I am in a CQC special measures organization. The discipline required to deliver the objectives set is so crucial for us to be successful. And you can have the ideas to solve the problems, but the discipline is key.
Yeah. And what happens? I get in this balance between management and leadership. And what happens when it gets out of balance? What's your feel for that aspect, or indeed if there's an absence of one or the other?
In my experience, very much that if there is an imbalance there, and a lot of that imbalance tends to actually come from the specific working relationship between the project manager and the leader, the clinical lead. I had one project about a couple of years ago where my clinical lead very much, we'd have our catch up outside of a big meeting we were about to go into, and I'd say, this is I think where we need to go with this, and we kind of lay down, how we were going to attack the meeting, and he'd agree with me. And then we go into the meeting, and then within 10 minutes I'd say a point, and he'd go, well, I don't agree with that. And effectively it was like he was pulling the pin on a grenade, throwing it into the middle of the room, and sitting back to watch.
The word's not helpful come to mind on that.
It wasn't, but actually what I then went away to do was actually reframe how I worked with that person.
Right.
And it's about understanding personal styles. So with that particular individual, it became about, you know, making sure that it was much more collaborative. So I've worked previously on projects where I had to take a bit more of a initiative in driving things forward.
Right.
With this particular clinical lead, very much it was about making sure that it was them taking it forward, and I was much more of a facilitator, which is absolutely fine. And it is about finding that balance. And so for me, that is possibly one of the most critical relationships in any improvement project, is that between the clinical lead and the project manager.
Right. So I'm hearing you can have an imbalance if there's clarity around role and relationships.
Yes.
And who does what. Nadeem, your perspective on that?
I think the key word there is relationship. So, and the relationship needs to drive the way you communicate and agree how you're going to communicate. I think it's clear that you need to understand how somebody faces up to problems first, so the multiple personality type breakdowns. It helps to understand how you function. But the relationship is key for the success. And actually then underpinning that is how you communicate.
Yeah.
So if you're having that last minute communication before the meeting, that was clearly going to fail for lots of reasons. So any project that people are doing, whether in small or large teams, as much as it is about the structure of the team as it is, so how are we going to communicate, both formally and informally, in order to make sure that the information flow, which is key to success, is going to work. And then how responsive are you to when issues come through that communication is also key.
Yeah. Well, we've had the first question come in, which very much builds on this, and that is, we've heard a lot about leadership skills needed by the project lead and clinical lead, both of you. Do other members of the leadership team, of the team, need leadership skills, and why? So again, this is leadership cascading down the organization.
I'll take a start.
Please, yeah.
So I think that's an easy. I think everybody needs to have leadership skills because. You know, it's about how you understand the concept of leading. So this is all, everybody in this conversation is about leading change, right? So that's what leadership is about in this. And for me, leadership actually starts with, well, leadership is about leading change. And everybody in the team is fundamentally leading change, some or big parts of a project. And I think if the skills are necessary on understanding, you know, the art of the listening and the developing and the building of relationships and how well you communicate, all of those, in one sense, are necessary prerequisites of good leadership. Okay, so it isn't a technical function that you have first and foremost, it's a professional relationship you're developing first and foremost.
Yeah.
And the word relationship is key. And actually every member of the team has to understand leadership skills and has to start practicing leadership skills. So you can't automatically assume that you have the skills. You will have to acquire them. Just as I, frankly, am still practicing leadership skills. And actually that's how you begin to build that capability.
Right. So I guess it's this phrase of distributed leadership, where, you know, in some respects you're the conductor of the orchestra, and you have leaders down the organization. Darren, your perspective?
I think very much I agree with Nadeem. Particularly when you work on any project, the change that you're affecting does not impact only on the people that are delivering it, and therefore anybody that is involved in it is a proponent for that change. And therefore you have to, you know, lead by example. You are supporting the delivery of this project, and therefore inherent in that is an element of leadership, be it through your personal networks, through your professional networks. And so yes, very much I think everybody has to have those leadership qualities and has to demonstrate them in delivering a project. And it also brings in this idea of where you have different people with different skill sets involved in a project. My particular skill set is the project and program management. When I joined my current project, I did not know very much about quality improvement, and so relied on networks that I had to lead me through that change. And I was very lucky in having a very supportive clinical lead. Equally, there are other areas that I don't particularly bring to the table in my own skill set. And so there are others in the team who take that lead on and actually help push that work forward in those areas.
Mm-hmm. So kind of a bit of a joint team effort in many respects, and that gets back to what John Cotter was also talking about in terms of aligning people down the organization, across the organization. We've had another question come in. Thank you very much for that. And then again, you know, if you haven't found the button, make sure you find the button. It's there on the screen, and keep the questions coming. This next question was we have members of our team who are very experienced in QI methods and who lead clinical teams. Am I right in thinking that you are saying that we need more than this, or is it something else? So again, technical specialists who lead the teams. So it's moving maybe from that technical quality improvement method insight into actually a broader range of leadership skills.
So I'll start with that. And so absolutely you need quality improvement knowledge and skills in order to be able to deliver the scale of project you're working on. So that's kind of a domain knowledge area. The overlap needs to be the domain expert for the area. So if you're dealing in an area of urology and it's not your area of expertise, then you need the domain knowledge of urology to overlap. So not everybody can be a QI expert. Mm-hmm. So the power of this is how do you engage people that don't necessarily understand quality improvement but want to work with you to lead change, and how do you as an expert in quality improvement knowledge and skills begin to share that domain knowledge to overlap well enough for you to be engaged together on that piece. Of course, then the other bit is the concept of leadership that comes into this. So in effect, if you're doing that, you're beginning to engage people, mm-hmm. and that's leadership, isn't it, really? Yeah. So you're displaying more than just the QI skills to get the project done.
Right, okay. Darren,
and very much, I think the same is reflected when you reflect on the project management side of things as mm-hmm. well. For me, project management is 10% paperwork, 90% managing people. Right. A lot of the people that you work with on a project, as a project manager, you have no control over. You're not line managing them. Mm-hmm. You have to bring them along with you and get that. And that comes with skill sets. On SAFE at the moment, we have a comms lead who is responsible for delivering the communications aspects of the project, and I'm involved in that, but that's a piece of work that they do. So again, on the project management side, all of the skills aren't vested in the single project manager. It's vested in everybody that's part of the team, from the administrator through to individual leads, through to your subject matter experts, through to the project and program manager themselves.
Yeah. So again, it's the key word that has kept coming up here is relationships. And let me tease this out then, because again, this is about scaling up, and scaling up implies working across organizations, working across different vested interests. So what particular leadership skills are required then in the system type of work where you're having actually to engage people who might not want to change? Nadeem, would you like to tackle that one first?
That's a very familiar experience. So system change, where there could be hidden resistance in one sense, or the sense that you're not clear that people want to be part of this game that you're now trying to lead on. I think it goes to what Heifetz said around appreciating that resistance is not per se resistance for the sake of it, but a sense of loss mm-hmm. that people are trying to manage and maybe even resist. The resistance is because of the sense of loss that's about to come their way. Yeah. And I'm very familiar with that. It reminds me of a meeting that I shall never forget in December of some years ago, when I was in a room full of people across the system trying to lead change. The amount of emotion that came out, it was extraordinary actually. There was anger, there were tears, and all of that was describing loss that they had collectively acquired a sense of because of the change that was going to come across the system. Mm-hmm. But I think that was an important meeting actually, because actually it brought it out and it allowed for an honesty of conversation that then allowed for me and my colleagues to begin to have the conversations that weren't anymore about the elephant in the room in one sense. Right. So I was really clear about the sense of loss that they were experiencing, and I was open about it. The opportunities that were right to bring it up when there was a conversation on the project plan, the project program, who was doing what, who was leading what. And actually that actually gave confidence to people around that we were honest about the losses that were going to be individual and service and organisation. But actually then how are we going to make it work as a better outcome for patients, and then understand how that could actually be better for the individuals and services although it's very difficult to give sense of tangible outcome of that tropical island you're trying to take people to, because actually it's still just a mirage for them when we talk about it. And the journey to the outcome is a lot of pain, actually, and actually being honest about it and experiencing it yourself, and actually narrating that sometimes, which is I had to do, and say, look, this is difficult for me, and narrate that, and then be honest about that loss.
Well, let me come back to your point that you raised there about, in a sense, meeting. We'll want to come back about the kind of means of change and sometimes how to do it. Just before I bring you in, Darren, there's another question that relates to this and probably provides a further dimension to, and it's what personal skills and resources do you draw upon when addressing conflicts that inevitably arise due to differing priorities, agendas, etc., across organizations affected by large-scale transformational change. So just thinking through your project management skills, it's, what personal skills and resources do you draw upon, and have you had to draw upon, or have you seen other people drawing upon?
There have been many examples where you have to manage that kind of conflict, and I think Nadeem's right. The first part of it is actually trying to make it a bit more personal. I think one of the issues that you always get with change is that people very much focus on their own issues, and it's very internalized. And I think sometimes the first step is actually taking people along that path that says it's not just you that is impacted by this. This is a much wider piece. I've worked on one project previously where I worked across two specialties, and each had their own particular way that they wanted a change to happen. And it was around the setup of a system, the language that was used. And I tried many different ways to get them to a common point. And part of it is actually that journey. So it's a bit of the negotiation skills. You're going to have people around a table. You're going to be saying, this is what you want. This is what you want. Let's start by looking for what those common themes are. In that particular case, it did come down to actually having to be a little bit blunt and say, you want this and you want this, and actually you're calling the same thing two different things. You want exactly the same thing. And sometimes it is having to reframe it. And I think that's probably a very good skill to be able to have, is to reframe what somebody wants or what the question is, to say, actually, let's look at it a different way. Because people do get very focused on a particular set. And when you come to change, when you're affected by loss, you have a very particular mindset, and it's very difficult to change that. And so actually this idea of reframing it and almost getting them to reframe it themselves is a really positive step that you can make. I think, and the other particular skill really is just communication. I think that the last thing you want to do is to shock people with change at the last minute. It has to be from the outset. And I think actually that's something that we're finding in SAFE at the moment. We're moving on to a second and third wave. And the first wave, very much people were tapped on the shoulder. Do you want to be involved in this program? It's a great thing. And they all signed up, and they've all been really, really excellent. But now I'm doing the site visits for the second and third wave, I can see the quicker progress they're making because they've chosen to be involved. It was an application process, and nobody was asked to apply. They've all done this off their own back, and straight away you can see a difference in the level of engagement and they appreciate that there is a loss in the sense that there's no additional funding for this work. They are doing it on top of their job. It's additional resource, it's additional work, and they're all signed up to it. And they've come to terms with that before applying. And so you kind of see that difference of actually, making sure people are fully aware of the situation. I think that and reframing are the key things.
Yeah, so it's kind of in the sense of getting people to want to do it as opposed to feeling they have to do it. And I guess there's a theme coming through this, that, keywords, about relationships, around communication. And this relates to the next question we have. And again, you're doing well in finding that button, so keep finding that and keep getting them coming in. And the question here is, how do we manage external individuals to the projects, but are leaders within their own department and organization? So they're kind of external leaders, and they may have a power base externally. How do we kind of manage them when they're maybe coming up against, in a sense, your own leadership roles? Nadeem, you want to?
So is that something about managing sideways and upwards potentially, I guess, in one sense?
It's back to John Cotter when he talked about that alignment aspect, across the way and then down the way.
So the challenge you have, colleagues on the other side of this, is that you're working across more than one service, across organisations, and that's always the toughest piece. I mean, it's in one sense tough enough to do change within a ward or care facility. You're taking on a greater challenge, and rightly so. I think the leadership expectation there would be about, yes, aligning the leadership, but actually understanding that if you're clear about the purpose and you've agreed the purpose, that you're developing leadership right across the piece. No matter how many jigsaw pieces are needing to come together, you have to develop leadership in those elements and develop with a common purpose and being clear about how you're going to communicate, both formally and informally, and ensure that actually, in one sense, it's why steering groups exist or board steering groups exist in one sense. So if you haven't got executive buy-in in one sense, then you're in trouble because you don't have the place to go to get things unblocked and also to keep people aligned on the objectives and direction of travel. And I think that's really key. So in one sense, you need to set yourself a place where you can have that professional challenge that is honest, that allows people to air things clearly, but actually make sure that you stay aligned around the objective of the project you're dealing with. But go and make sure that they're developing teams as much as the way you'd expect to develop your own team around who's responsible for what and who's doing what, so that there isn't a balance problem across your system, so that everything's weighted on one side when it should potentially be more equitably shared across. It's a tough piece, but it requires that discretionary effort. And I have to say, when I was doing this, I'm not saying this is what you should be doing, but it's a 70, 80-hour week for me initially to get to understand the people, to get to go to the people, to get to talk to the people, rather than assume that the email or the telephone call alone was going to do this piece. Eyeballing people is key to this.
Well, that last point you mentioned, 7 to 8 hour weeks, that relates to resilience. And as Ron Heifetz says in his article about the permanent framework for change, in many respects, you have to invest in yourself and that resilience. And this links probably to a question that, let me bring it in, Darren, bring you in on this one. So thank you for this next one. And it refers to what Ron Heifetz had on the last slide we talked about dancing on the edge of authority into leadership territory when you're getting out of your kind of familiarity box. And it says, do you think a good leader should constantly dance on the edge of authority or just some of the time? And what does dancing on the edge of authority look like? Now, I guess, Darren, from your perspective, maybe comment on what you see in leadership of projects you've been involved in, and then coming back to kind of how you as a project manager play into that and support those leaders, as obviously you're a leader yourself.
In terms of kind of leadership and that balance between authority and leadership, the projects I've worked on, very much because some of the clinical leads I've worked with, you only see through the perspective of the particular project that you're working on. You only see certain aspects of it, and very much it is around the leadership side. So they spend a lot of the time very much on the leadership side of that divide, particularly at the start of a project. And I think this kind of comes back to what Nadeem was saying, almost, that when you start to do those things about that sideways leadership and that upwards leadership, what you then have is a matrix almost of the work that the clinical lead will do in terms of that leadership, going out, doing all that eyeballing, having that communication, and having that support framework underneath to do that. So as a project manager, you would be supporting things such as stakeholder analysis, in managing these sort of boards, and steering groups, and providing that access. And that is where you start to see the leaders step more across into that authority side, where you give them those more formal settings to undertake some of their leadership. And that's where, as I say, you start to see them drawing more on their authority, be it sometimes in some quite guarded ways, but just some of the tone and the undercurrent, you can start to see that switch between those, I want to go and speak to somebody on a one-to-one basis. That for me is much more of the leadership style, whereas you can give them the formal settings that there's much more around the authority.
Yeah, okay, right. So Nadeem, again, this is, almost, how much do you really push the boundaries on these things, and maybe then how much do you back off and kind of pushing, backing off?
So that's the political intelligence that you require to get this sort of work done. And I think that's I'm not saying that you either have it or you don't. You're going to have to acquire the political attorney to allow you to understand where do you need to go and interface and start challenging some of this. So there's no easy answer to this. Again, it's about being very, very aware of your landscape, being very, very aware of what you're hearing about the project that you're doing right across the health economy that you're working in. And be actively seeking it out with your colleagues around what people understand and are saying about it, so that you can begin to distill a better sense of what the issues might be before you then start dancing at the edge, if that makes sense, around challenging the issues. Because if you're getting a sense that there is a growing swell of a problem, then you're going to have to get the support of your senior leadership that you're managing upwards to understand what is it that's going to help you do your job well in the context of the board members maybe, or the execs that are supporting you to deal with what is going to become a real issue.
Yeah.
So that heading off the issues is going to require you to go to that edge more often than you might appreciate.
Yeah. So you're kind of at the edge, and what was going through my mind when you were talking there was what John Cotter talked about also in terms of kind of having the kind of coalition behind it, the coalition of the willing or the supporters, and often the phrase is, what gives you your authorizing environment to do this, and knowing who's going to provide covering fire for you when you're actually on the edge. Which links back to this next question, thank you for this next one, which was, would a concorded approach to aligning leadership and executive buy-in be recommended? Now, this is a closed question, and my answer, I'm tempted to give the answer immediately no, but let me put my cards on the table on this, and that's a concorded approach to me is when you actually get up your pen and you have to write down the rules of engagement, of leadership. And arguably, I would suggest that when you're getting into that point, it's maybe a busted flush. I'll just try this one on you, because if you've actually got to write down, who's going to do what, how you're going to get along together, then that almost implies that, mix all my metaphors, kind of last chance saloon. Whereas it gets back to what are the relationships, what are the kind of focus that you're taking as leadership and project management, and maybe also, Nadeem, let's come back to, you mentioned earlier about this powerful meeting where people brought their emotions out. So against this background of your view on concordant, and Darren, I'll come to you too, but what other means are there of, in addition to maybe concordant and the meeting, what other means have you used of, in a sense, surfacing the change issues, addressing the loss that people are going through as they're having to address and force through improvement or get people behind it?
I agree with you, John, on that. Maybe we've overread the question, but I agree that if you start setting a rule book on this, you're going to fail, because this isn't a technical thing you're doing it. This is psychology, colleagues. In the end, what you're doing is you're dealing with human behavior and psychology. And a rule book is just going to constrain you down a technical route and you'll fail. It's very simple. So, but it's key that so the psychology is really key. So just if you remember, when you're doing change, systems you need to understand really well, data and variation you really have to get. The psychology of people around you, the service, its history, the relationships is really key. And then you start doing that project of improvement. I've just described Deming, right? That's what I've just described. So I think that there is that huge risk on that sense of I'm not going to go anywhere until I've got the alignment I need and everybody has the rules agreed. What I'm about to now say is actually, I'm sure it's written down somewhere, but I was only able to surface the challenges and the issues by really spending that time to go and talk to people, actually listen to people fundamentally. Because if you're not listening, then you've lost the conversation. If you've gone there to tell them something, you've lost them immediately almost. Right. And then you need to build your team that understands how they need to behave in that context. So if you're working across a number of different silos potentially or services, that approach is going to have to be key to your success around the listening and the learning to begin to then say, okay, I think I know how to engage in order to begin to get this thing to work as a collective. It's really tough work though, because it's understanding the psychology of the person in front of you and the psychology of the group in front of you. And those are not always the same thing, because they will behave differently in a crowd as they will with an
Yeah.
individual. So you need to do all of that.
Okay. We have another question, but let me ask you, view on Concordat, Darren, the extent to which you've ever seen one or been involved in one?
I think from a project management perspective, it's that separation between behaviours and responsibilities. On a large scale program like SAFE, we have various groups and boards, 5 or 6 I think in total. And what we, as part of that, we set up terms of reference that describe the roles and responsibilities of those groups.
Yeah.
What we haven't done is gone down the route of saying these are the behaviours we'd expect.
Yeah.
And very much what we look at is that, for me, is one of the roles of the clinical lead. If there is any behaviour that steps out of what is expected, and it's very unwritten, but if it steps out of what's expected, then the clinical lead, it's their responsibility to go and address that very much on that one-to-one basis. But I think, no, you're right. I think the moment you start having to almost contract how we're going to deliver this as a group of people, I think it just, you're not going to succeed.
Can I add to that briefly? So my organisation is partnered with Virginia Mason in Seattle. There is this construct or concept of the compact. So this is, in one sense, trying to describe the psychological contract between the employer and employee, or the leadership and the employee. And it took them quite a while to get to that construct and make it work. It's not gone through every layer, and it takes time to make that mean something as a relationship. It's a very powerful instrument, I believe, because it allows a sense of what the give and the get is in the relationship. It also gives a real sense of how you can test back on what feedback should be, and behaviours as well, so you can test back on that. But I think the concept in where we are with these projects and programs, I think you're right. It's about what real leadership should be about, which is about setting the standards on behaviours and making sure that they're understood, and that you pull people through on that quickly rather than too late.
So folks out there, you've heard our view on this. If you have a separate view yourself and you feel there is benefit in a Concordat, certainly put your view or put your question around that. We have another question here. Again, this is around the focus on scaling up, large-scale improvement. So the issue here is our project is geographically dispersed, working across a large number of sites. How do you keep the momentum going, and how do you engage those who are not in the immediate project team, i.e. keeping everyone moving in the same direction, although they have different levels of involvement? So again, I can picture a number of these projects, different sites. In some respects, you might not know who to engage. So there might be that aspect. Darren, do you want to tackle on that one first?
Yeah. So SAFE has 28 sites all across England, and so it's an issue that we.
You do a lot of traveling, do you?
I do a lot of travelling. I think I'm in the office 3.5 days between now and the 11th of January. So lots of travelling. And for me, the real success that we have there is twofold. I think one is providing the opportunities to bring together the different teams. So we use the IHI Breakthrough Series collaborative model. So bringing those teams together, and it provides them, I think, that focus to actually work on it, and gives them that time away from the organisation. But equally, it's providing the support to them to set up their own local team. We're not going to implement SAFE from central London across the UK. They have all got their own local contexts, local issues. And so really it's about empowering them to say, this is the programme, this is what we want you to do, go away and work with your local team. And so each of them has set up their local project team, and we go out there regularly to visit them, but equally we offer anything else that they want. So we've been out and we've done grand rounds, we meet chief executives, we meet smaller teams. It's really about giving them the ownership, and so they can have their own team, and then it means that you then have to work with a smaller group of people to empower them to go back and deliver it. So it's almost, for want of a better phrase, a bit like a train the trainer sort of model. You work with a small team, and then they can go back and work with the rest of their team. And so we focus on giving them those kind of skills. We talk about actually, how do you work out who your key stakeholders are? How do you engage with them? Is it better to try and bring on one of your big critics earlier, or is it better to actually get your quick win with someone who supports the work that you're doing? And by giving them those skills, they're able to go and implement locally, and actually that's been a great success for us.
Yeah. Well, again, it's maybe a supplementary question for you, building on this, is that Richard Seal in his article talked quite a bit around the conversation, the communication. And I guess from your project management point of view, what type of story do you tell that begins to engage these people, that gets them behind it? You know, what's the leadership narrative that, you know, not just, you know, relying on the you know, project lead, but, you know, what kind of leadership narrative do you have that engages them?
For SAFE as a program, I think very much what's really engaged people has actually been from our clinical lead, because he talks from his personal experiences. You know, he talks about, you know, we focus on deteriorating children, and he talks about, you know, a number of incidents where when your child has died and he's had to sit down with the parents and say, you know, we watched your child die, you know, perhaps the obs weren't there, but we knew there was something that wasn't quite right. And straight away, that it's that personal touch that I think really does it, because I think everybody that we work with has got a similar story, perhaps not to the level of, you know, a patient dying, but a patient where, you know, they perhaps didn't thought there was something that wasn't quite right, and they feel that, you know, they see the benefit of the work that we're doing. So for me, it's always about that personal experience. The easiest way to turn someone off to change, and, you know, we've talked about this already, is to tell them that they have to change. And so those personal reflections are always, for me, a step through that says, actually, is there something that, you know, that I can empathise with, and I understand that situation, and it's happened to me. And that's that first step. And I think once you get that first step, the rest of it comes very easily.
Okay, thanks. Nadeem, again, yourself, you know, from this perspective of kind of, you know, diverse geographically, you know, tapping into engagement, keeping up momentum.
I'll come to that in a second. I think you're absolutely right. So thanks for bringing up the patient word. So it is about patients, and it is about the power of the experience of patients that is effectively why everybody's doing this work, I would argue. The changes are happening to benefit patients, and it's quite difficult sometimes to simply use that. So I think it's also about the data that is telling us something about the system, but actually brought to life by the patient stories about personal experiences and why that data really means something to allow the system change, to understand the psychology, and then do the improvement work. So I think in terms of the momentum, I don't want to tread on your toes, but the reality is to maintain the momentum is to really be disciplined around the plan that you've set out, and be clear about how that plan is going to have the space to allow for extracting learning very quickly, so that although you've got milestones and you've got the clarity around how you're communicating, the space to step back and say, actually, we learned something different here, but we need to maintain the momentum, and how does that fit in? So the rigidity can be a risk in one sense, but the momentum is necessary through that project management construct. I also think that in terms of keeping people abreast, even if they're not directly involved, so in Kotter's retrospective analysis of big change, on his book on on change, on the 7 elements, or was it 8? I can't remember exactly. But communication was key.
8,
actually really key around, and be purposeful communication rather than as an afterthought. So you got to plan that piece and actually be clear about at what point you're going to keep releasing the necessary information as the project progresses.
Yeah. Well, that, again, thanks for this next question. Again, keep finding that question button. We've just got over about 10, 13 minutes or so to go. And this next question links into that, Nadeem, in the sense of, again, dispersed project, having to engage people. And this question is, how do we re-engage senior management in a multi-center project where there appears to have been reduction of their engagement over time? You know, changes of management priorities, et cetera. So the questioner is saying, right, you know, we've had less, we're seeing less engagement now. We want to re-engage those senior managers in this multi-center project.
I guess I'd like to understand why and how they got disengaged. So if this is another new concept or new innovative idea, and on the sidelines you've got disengaged senior management, then I presume it's something else that's made them kind of disengaged, and now you're bringing them another solution or approach. And that's a really interesting observation for me in one sense, which is, why do clinicians as well as managers go through these cycles of increasing frustration in terms of change? And I think partly it's because the approach we've taken is not consistent. And actually we've not been consistent with the primary aim of change, for me, is about making it into a learning construct, right? If it's all about the technical aspects of change, rather than really anchoring on what makes us as human beings tick, which is wanting to be curious and to learn, then we've lost them, right? So it's very easy to lose managers if you're not brought them in and understand this is a shared journey of learning. Clinicians are the same. So whatever's disengaged them, I can understand, because whatever approach of change has taken place is partly to blame for why they've become disengaged.
Right.
So the quality improvement science, for me, is exciting because it's underpinned by the really powerful construct of learning, really. Learning from failure as well as learning from success. That's why it works. Any other approach, I sometimes jokingly say, you come to me with the change method, and if I don't see Deming in the fossil record, thank you for coming to see me, because it's the learning component that matters.
Right, yeah. And underpinning this, Darren, to what extent have you experienced that disengagement and then having to re-engage?
We've been quite lucky. All but one of our sites has managed to keep that engagement going, and I've got two examples. One is one of the sites that got disengaged, and we're working with them still, and I think you're very, very right. I think for us as a program where we're actually evaluating it, we want to engage with them even if they don't come back on board fully, to learn what their barriers were and why it didn't work on that particular site. But with them, actually, it's part of it is recognising the issue. In this particular case, they had a clinical lead that had a particular way of working and wanted to be convinced themselves before they went away to convince the rest of their colleagues. Unfortunately, there were various other things that happened that meant he was not available for a while, and so they were then behind the curve, and we had a number of attempts to re-engage with them, and finally they've started to come back on board, and with that, it's really a case of having to be a bit more active with them and actually think, well, am I speaking to the right people and offering support where you can? Sometimes it's not just about working with their clinical lead and letting them have that discussion. Sometimes it's about actually going in and saying, right, well, you've signed up to be part of this program. What's going on? And there's a bit of investigation that needs to go on. And I think that in that situation, in this particular case, we are starting to see that re-engagement, and a lot of that has been by stretching the team that's been involved, so it's not just that individual, by actually directly engaging other people through networks that we have and say, well, we were doing this, is this something you're interested in? And that's given us a bit of momentum with that. With another site, they lost their clinical lead and were going through a lot of difficult issues at the time. And so with that, it was about actually saying, well, how else can we work with you? And in that particular case, we offered them some additional support that was covered by the programme. And it's really about recognising those individual needs. And I think the important thing, and we go back to this, is that a lot of the work that we do, people are doing in addition to their day job, sometimes without any additional resource. And unfortunately, that means that if you don't have the passion or the drive, this is the first thing that slips. And so actually it's about going in and saying, well, how can we support you on a more individual basis? And looking at those options and seeing what we can do.
Well, that thanks, Darren. That links to this next question. And we have one now. We probably have hopefully time for one or two more if you can get them in. The question is, what advice or training could you give those who have not had formal management or leadership training, and where might they get that support? Now, I guess, just an observation from me initially is the question, to what extent do you need formal management or leadership training? One of the best leaders I worked with was an individual who had basically no qualifications, no formal training, but he had empathy. He could empathize, and he knew how to motivate and get people behind. And we had one of the earlier questions about people who are experienced in QI methods, and they're technically correct and technically there. So against that background, Darren or Nadeem, you've been to Harvard. You've been there. You've listened to Ron Heifetz. Any views on this? Advice about getting formal management, leadership, or training? Where might they get it?
So I've been very privileged and very fortunate in being exposed to leadership skills, understanding. I think it's worth making that transatlantic journey to listen to Heifetz, by the way. I can't give you the money back guarantee on that. But
are you going to help fund it?
But I think you're right, John. I think that this isn't about leadership born or you're born a leader or you're not born a leader. I don't think that's the issue. I think it's really about understanding the psychology of people and of teams and of services, and being able to understand what it is that people what brings people to work, what challenges people, and how you engage and get the best out of people. And you're right. If you really feel you're missing something, so that question is there something missing in me that I feel I need to be exposed to become a better leader? The answer is, the way I did all of this was do a lot of reading. I enjoy reading, but I think reading some really good, articles certainly were good books that were reflective and actually honest, rather than about, that perfect world which doesn't exist, was kind of my journey into this, in one sense, many years ago. And I think that's a really good way of doing it. But the other bit I would strongly suggest is, it's not the letters after your name that matter. It is actually, reality is who's your mentor? Who do you look up to that you think people also recognize as an example of good leadership, with the ability to deliver that psychology of leadership, the engagement piece, and so that's how I learned as well, and that's how you can learn as well.
Okay. Well, I'm just conscious of time, and what I'd like to do is get your final reflections and kind of takeaway messages. And just while you're thinking on that, if I could reiterate, if you have further questions or comments or observations then that you haven't got in during the webinar, then please email Sally Williams, and we'll get back to you. We can kind of keep this going. This is an ongoing live discussion. This webinar builds on the previous one. It'll roll forward in terms of learning for the next one, and then our engagement with the individual teams. So again, your kind of final reflection in the last minute or so, just in a minute from you, Darren.
I think it's what we talked about earlier, very much about making that relationship between the clinical lead and the project manager work, and recognising the different skills that they bring to the table. The leader very much is the one for me that will drive it forward, and I see my role as a project and programme manager very much to facilitate that. We're all in this together. We all want to deliver the same thing, and it's about finding how that relationship works, where the balance of responsibility and skills lie, and using that in a really positive way to deliver the project that you're working on.
Okay, great, thank you. Nadeem?
So a lot I could say, but in the short time I have, I think, to be realistic, that this is really tough work. Without any doubt, it's really tough work. So I would ask that you think about where you get your resilience from. How are you going to keep yourself really up with the energy that's required? And as a leader, you've got to be able to display that and work through that. And I think it's also about being honest about those challenges that are coming ahead. So the loss issues really need to be up and be part of the narrative. But I think it's also about being honest that you need those concepts, some of which have been shared today. So the quality improvement construct for me, in my DNA, Deming is in my DNA. And I use that as a reference almost every day about when I'm connecting with people around change. Am I hearing those bits that genuinely, when they come together, gives those individuals in my team a chance to deliver well? And if I don't, then my duty is to coach through that conversation rather than tell them how that might be. So coaching is also key to this.
Thank you, thank you. Well, just, a few kind of key words hit me between the eyes when I reflect on what we've heard today. Start with that last one, resilience. Look after yourself out there. Look after yourselves, look after your colleagues, your peers, because you rely on them and they rely on you. Relationships, we've heard that key word all the way through. Communication, honesty in those relationships. Trust comes in, having that narrative, and consistency, but also knowing when to change and when to push the boundary. So thank you very much to Nadeem and Darren. We're going to need to leave it there. Again, if you have any final comments today from points you haven't heard, then please put those in questions to Sally. And thank you to everyone for watching and submitting those great questions. And they really challenged us to kind of think about our answers. And also, you'll hear further about the webinars that we'll be putting on next year. So I'm tempted to say Merry Christmas, but it's a bit too early for that. But we probably won't be speaking to you before. But anyway, thank you very much for watching the webinar and to support the Scaling Up Improvement Program. Thank you very much.
Thank you.
Thank you.